Welcome to an exploration of one of the most vital and rapidly expanding fields in modern science, health psychology. This discipline stands at the fascinating intersection of mind and body, offering profound insights into human well-being. It is a field that challenges traditional views of health and illness. Health psychology is a dynamic and evolving area of study. It systematically investigates the intricate relationship between various factors and our physical health. This field delves deeply into how our internal world and external circumstances shape our physiological state. Specifically, health psychology focuses on psychological factors. These include our thoughts, emotions, beliefs, and coping mechanisms. Understanding these internal processes is crucial for comprehending health outcomes. The field also meticulously examines behavioral factors. Our daily habits, lifestyle choices, and reactions to health information all fall under this critical purview. These behaviors are often direct determinants of our health trajectory. Furthermore, health psychology considers social factors. The influence of our relationships, cultural norms, socioeconomic status, and community support are all integral to this holistic perspective. These external elements profoundly impact our health experiences. The importance of this field cannot be overstated. It represents a crucial area of study in an increasingly complex healthcare landscape. Health psychology provides the framework to address health challenges comprehensively. It helps us understand precisely how our thoughts, feelings, and actions profoundly influence our overall well-being. This understanding moves beyond mere symptom management to address root causes. It empowers individuals to take a more active role in their health. Moreover, health psychology helps us understand our susceptibility to illness. It reveals the psychological and behavioral pathways that can either protect us or make us vulnerable to disease. This knowledge is vital for preventative strategies. Finally, this field illuminates how individuals respond to healthcare interventions and medical advice. It explores factors influencing treatment adherence and patient satisfaction. This insight is invaluable for improving clinical practice and patient outcomes. At its heart, health psychology is dedicated to the investigation of the mind-body connection. This fundamental principle underpins all research and practice within the field. It recognizes that mental and physical states are inextricably linked. The discipline meticulously examines how stress impacts physical health. Chronic stress, for instance, can lead to inflammation, weakened immune function, and cardiovascular issues. Understanding these pathways is critical for intervention. It also explores how emotions influence our physical well-being. Positive emotions can bolster resilience, while persistent negative emotions may contribute to various health problems. The emotional landscape directly affects our physiological state. Furthermore, health psychology investigates how lifestyle choices impact physical health. Diet, exercise, sleep patterns, and substance use are all powerful determinants of health. These choices are often driven by psychological factors. The field also highlights how social support affects physical health outcomes. Strong social connections can act as a buffer against stress and promote healthier behaviors. Conversely, social isolation can have detrimental health effects. Health psychologists play a unique and vital role in the healthcare system. They often act as detectives of well-being, meticulously piecing together the complex puzzle of health and illness. Their work is both analytical and deeply human. They uncover the complex interplay of psychological, behavioral, and social factors that contribute to health and disease. This comprehensive understanding allows for more targeted and effective interventions. Their insights bridge the gap between medical science and human experience. A primary activity of health psychologists is to develop interventions to promote healthier behaviors. These interventions are evidence-based and tailored to individual needs. They aim to foster sustainable changes that improve long-term health. They also implement interventions designed to manage illness effectively. This includes helping patients cope with chronic conditions, adhere to treatment regimens, and improve their quality of life. Their support is crucial for navigating health challenges. Health psychology encompasses several key areas of focus, each addressing critical aspects of health and well-being. These specializations allow for targeted research and practical application. They demonstrate the breadth of the field's impact. One major area is stress management. Health psychologists teach individuals a variety of techniques to cope with stress more effectively. These methods are designed to mitigate the physiological and psychological toll of daily pressures. Techniques often include mindfulness, which cultivates present moment awareness and reduces rumination. Relaxation exercises, such as deep breathing and progressive muscle relaxation, are also commonly taught. These practices help calm the nervous system. The aim is to mitigate the harmful effects of chronic stress on the body. Prolonged stress can have severe health consequences. For example, chronic stress can increase the risk of heart disease by up to 40%. Another crucial area is health behaviors. Health psychologists explore the complex reasons behind individuals' choices regarding their health. This includes understanding why people engage in behaviors like smoking or unhealthy eating. They investigate the psychological barriers and facilitators to adopting healthier habits. This understanding is essential for designing effective public health campaigns and individual interventions. It moves beyond simply telling people what to do. For instance, regular exercise is a health behavior with profound benefits. Research consistently shows that engaging in regular physical activity reduces the likelihood of depression by approximately 30%. This highlights the powerful mind-body connection. Chronic illness management is also a significant focus. Health psychologists provide invaluable support for individuals living with long-term conditions such as diabetes, cancer, or autoimmune disorders. Their role extends beyond medical treatment. They offer practical strategies for pain management, helping patients cope with chronic discomfort. This might involve cognitive behavioral techniques or mindfulness-based approaches. Improving daily functioning is a key goal. Furthermore, health psychologists assist with treatment adherence. They help patients understand the importance of their medication regimens and lifestyle changes. This support is critical for managing complex conditions effectively. Ultimately, their work in chronic illness management aims to improve the overall quality of life for patients. They help individuals adapt to their condition, maintain independence, and find meaning despite health challenges. This holistic approach is transformative. Finally, doctor-patient communication is a vital area of study and intervention. Health psychologists focus on improving the quality and effectiveness of interactions between healthcare providers and patients. Clear communication is paramount. Better communication leads to a more profound understanding of medical conditions and treatment plans. Patients who feel heard and understood are more likely to engage actively in their care. This fosters trust and collaboration. Crucially, improved communication also leads to better adherence to medical advice. When patients fully grasp the rationale and importance of their treatment, they are more likely to follow through. This directly impacts health outcomes. The impact of health psychology extends far beyond academic research. It has tangible, real-world benefits. Understanding these benefits underscores the field's critical importance in contemporary society. Its contributions are multifaceted and profound. Firstly, health psychology leads directly to improved health outcomes for individuals and populations. By understanding the psychological, behavioral, and social factors influencing health, more effective interventions can be developed. This knowledge translates into healthier lives. Secondly, the field helps to significantly reduce healthcare costs. This is achieved in several key ways. By promoting preventative behaviors, health psychology lessens the incidence of chronic diseases. Prevention is always more cost-effective than treatment. It also assists with chronic illness management, which can reduce hospitalizations and the need for intensive medical interventions. Effective self-management strategies empower patients and alleviate strain on healthcare systems. This proactive approach saves resources. Thirdly, health psychology profoundly enhances the quality of life for countless individuals. It achieves this by assisting individuals in coping more effectively with illness and its associated challenges. This support is invaluable during difficult times. It also helps people adopt healthier lifestyles, leading to greater vitality and well-being. By fostering positive habits, health psychology empowers individuals to live fuller, more satisfying lives. This impact is both immediate and long-lasting. Consider a specific impact example that powerfully illustrates the field's importance. Psychological support provided after a heart attack can significantly lower the risk of another cardiac event. This intervention addresses the emotional and behavioral factors that contribute to recurrence. This support might include stress reduction techniques, education on lifestyle changes, and coping strategies for anxiety or depression. It demonstrates how psychological care is not merely an add-on but an integral part of recovery and prevention. The evidence for its effectiveness is compelling. In conclusion, health psychology is a constantly evolving and expanding field. Its dynamic nature reflects the ever-growing understanding of the complex interplay between mind, body, and environment. It is a discipline that continues to adapt and innovate. This field has a profound and undeniable impact on both individual health and collective well-being. It moves beyond a purely biomedical model to embrace a holistic view of health. Its influence is felt across clinical practice, public health, and personal lives. Ultimately, health psychology empowers individuals to take greater control over their own health. By fostering a deeper understanding of the mind-body connection, it provides the tools and knowledge necessary for proactive health management. This empowerment is its greatest legacy.